Let's talk about clamshells. I'm Dr. Nichelle Gurley and I'm specialized in prenatal and postnatal movement. I'm going to come down onto the ground. Clamshells are great for working on the glute med, which is the side butt right here, so not that big meaty part of your booty, and that's going to help with pelvic stability. So this can be great for working on that muscle so it engages better so that you can have less discomforts during pregnancy. So clamshells, it's a little bit easier to do it when you're down on your elbow, so lower down to your elbow. And you can do it without a band and just as simple as keeping your ankles together, drive that top knee up and slowly lower it down. And the slowly lowering it down is important because a lot of people just want to drive it up, back down. So it's slow drive up, slow drive down. Now to make both sides work, what you can do is think about your hip and your knee actively pressing into the ground on the bottom leg as this top leg drives up. So now both sides are working that glute med a little bit more. If you're not feeling much with this, you can add in a looped band. So bring that band around your upper knee, come back down onto that elbow, and without the lower leg engaging, you can start by just lifting the top one, see how it feels, and then you can actively push your hip and your knee into the ground as you drive up that other leg. And so that'll be the harder version. And of course, you can make it even harder by making the tempo slower. So I could go up to 5, count of 5, 1, 2, 3, 4, 5, lower, 2, 3, 4, 5. So the slower you make it, the harder it'll be. Adding a band, it'll be harder. And adding your knee and your hip pressing to the ground will also make it harder. So the easiest would be where you're on your elbow, one leg's lifting up. You can make it harder by pressing bottom leg into the ground, and knee lifting up, make it harder by adding the band, etc. So there's a lot of ways to do the clamshell. You will start with the easiest first to make sure it doesn't cause discomforts, and then you can slowly increase to see what your body can handle.